Hi, I'm Marie Julien. My heart journey started with my noticing a few moments of feeling my heart rhythm was off, very fast, irregular. It felt like a fish out of water flopping around inside my chest. I mentioned this to my family doctor because the feeling happened only now and then. It was only a few years later that the timing worked out for an ECG to confirm atrial fibrillation, AFib. This was in 2006. I was 42. I had a demanding and successful career with 2 young children. I was physically active, typically chose healthy food options, and had a strong social support network. I was too young and healthy for a heart condition. AFib episodes leave me tired and weak, barely able to get through the day's demands. Over the following years, episodes got longer in duration, lasting days at a time. Eventually, the episodes would no longer resolve themselves on their own. They made the job of planning difficult, at work, at home, with friends, not knowing when I would have the energy to follow through on my commitments. Online searches told me about the elevated risk of stroke, and this cloud is never too far away. My first cardiologist told me, don't worry about it. This turns out to be very bad advice for an AFib patient. I was referred to the Heart Institute, where we have worked through various approaches to managing the condition. I've spent a lot of time searching for and absorbing information from patient materials created by the Heart Institute and others, websites, research papers available online, books, and other people who are living with AFib. I want to understand what we know and what we don't know about AFib. Some of the insight is gold standard based on randomized control trials. Some of it is in the "this works for me" camp. I've been inspired by those insights and made changes to how I live my life to improve my health outcomes. It's not all pretty. I still have the occasional high drama day when I get angry with another episode. It's an ongoing adventure. Having a heart condition helped me to focus. I spend my time and energy where I believe they're having a positive impact. I keep thinking, learning, and trying new things in all aspects of my life. I try to appreciate the gift of my life I've been given and live it to its fullest. My heart condition does not define me. It's only part of my lived experience. Taking control of my habits is how I live with having a heart condition. I'm the expert on me. As I experiment and explore ways to manage my condition, I feel like I can have an important influence on how this unfolds. Take the time to dig into and learn about your condition and take the action needed to set yourself up to live your best life.
In support of WearRed Canada and hashtag Our Heart Matters initiative, here with us today is Grenon. Anne is a registered nurse on the Arrhythmia team focusing on atrial fibrillation at the University of Ottawa Heart Institute. Thanks for being with us today.
Happy to be here.
My first question is, can you provide us with an overview of what atrial fibrillation is and how it relates to women?
Your heart is a muscle that works like a pump to move the blood through the body. There's 4 chambers. There's the 2 upper chambers that are called the atria and the 2 lower chambers that are called the ventricles. The pumping of the heart is regulated by an electrical current or impulse, kind of like a spark plug in a car. The electrical impulse starts in the sinoatrial node and then spreads through to both atrium with like a ripple in a pond. So this causes the both atria to contract, squeeze the blood into the ventricles. In atrial fibrillation, the electrical impulse comes from the atria in an irregular pattern, which with too many random triggers firing, your heart beats irregularly and sometimes too fast. The atria are quivering rather than contracting, and this disrupts the smooth blood flow through the atria. So there's 3 different types of atrial fibrillation. There's paroxysmal atrial fibrillation that comes and goes on its own. The episode starts suddenly and then reverts to normal rhythm without any medical treatment. Then there's persistent atrial fibrillation, which is an episode that can last longer than 7 days, and a treatment is usually required to revert to normal rhythm. And then there's permanent atrial fibrillation, when your heart is always in atrial fibrillation. Several different types of treatments or medications have been tried, and nothing has been able to revert your heart back to normal rhythm. and it is unlikely that your heart will go back to normal rhythm. Some of the symptoms of atrial fibrillation is rapid heartbeat or feeling like your heart is skipping a beat, breathing problems. So some people have shortness of breath, dizziness or fainting, tiredness or lack of energy, and some people do have chest pain, tightness, or pressure. Anxiety is one of the symptoms too. You feel like something is just not right. Atrial fibrillation is the most common arrhythmia that affects women and men. Women tend to have more different symptoms of atrial fibrillation, such as fatigue, weakness, and sometimes less aggressive symptoms than men. For that reason, atrial fibrillation may be ignored and then can be harder to treat in some cases.
Okay, thank you so much. My next question is, what are some of the known causes or risk factors associated with this condition?
Some risk factors include your age. So simply being over the age of 60 makes you more at risk. Having other health disease, including coronary artery disease, so meaning if you've had a heart attack, you've had stents, or you have a known blockage in your coronary arteries. Also, having a known valve disease or recently having open heart surgery or any other heart rhythm problems such as atrial flutter can increase your chances of developing atrial fibrillation. Some risk factors can be modifiable, so therefore you can modify your lifestyle and to change them. So hypertension, obstructive sleep apnea, and obesity increases the workload of your heart. So therefore, keeping a controlled blood pressure, wearing your CPAP machine as prescribed, and maintaining a healthy body weight will help. Having diabetes, so maintaining a good blood sugar will help with symptom burden also. Drinking alcohol can be a trigger for most people, so decreasing your consumption or completely stopping drinking is recommended. Smoking or tobacco use also acts as a stimulant and triggers your atrial fibrillation, so quitting smoking is always recommended. And finally, having an overactive thyroid gland can provoke atrial fibrillation.
Okay, and what information can you share with regard to steps that should be taken to face the specific challenges of this condition?
So atrial fibrillation is a chronic disease that is that cannot be cured. However, modern treatments can give people living with atrial fibrillation an excellent quality of life. Like any health problems, living with atrial fibrillation can disrupt and frustrate you because it does make you feel unwell, limits your everyday activities, and takes up a lot of your time and energy. So if you feel any irregular or fast heartbeat, or if you feel faint or dizzy, sit down or lay down immediately. Call your family, caregiver, or a neighbor to help you. Take your pulse, find out if it's fast, if it's regular, if it's irregular. In most cases, the symptoms will settle by themselves after a short time, and you will be able to carry on as normal. In fact, many people will rarely do anything more than rest for a short period when they have symptoms. But if you continue to feel faint or dizzy for a prolonged period and you become short of breath at rest or feel chest pain, call 911 for an ambulance to take you to the nearest emergency department.
And finally, could you share some word of wisdom or advice to the audience in support of raising awareness around women's heart health and well-being?
Listen to your body and do not ignore any heart symptoms. Because women may have different symptoms, atrial fibrillation can be ignored and can be harder to treat in some cases. Keeping your healthcare professional informed of your symptoms and advocate for your health.
Thank you, Anne, for the valuable information you shared with us today. We want you to be mindful, curious, and proactive in the management of your heart health and wellness. Because to take care of others, you need to first take care of yourself. Stay safe and heart healthy. To learn more about the unique aspect of heart disease in women and what you can do, visit WearRedCanada.ca, or speak with your healthcare provider. And join us on February 13 for WearRedCanada.